Do you frequently feel like your heart pains sometimes? Imagine instead that you notice a persistent lack of puberty changes, no deep voice, no growth of body hair, or no menstrual periods when you would expect them. This feeling can be a clue to a condition called Hypogonadotropic Hypogonadism, Kallmann Syndrome. In simple words, the brain is not sending the right go signal to the gonads, testes, or ovaries to produce sex hormones, and many people also lose their sense of smell. Think of it like a thermostat that never tells the heater to turn on. The body stays cold for puberty. The root cause of Kallmann syndrome is mostly genetic. Some people inherit a single altered gene on the X chromosome, ANOS1, while others get 2 copies of a changed gene from each parent, autosomal recessive, such as FGFR1, PROKR2, or CHD7. These genes are like construction blueprints for the part of the brain that releases the hormone-releasing hormone, GnRH, and for the cells that give us the ability to smell. When the blueprint is flawed, the wiring never finishes, so the signal never reaches the gonads. Occasionally, a random mutation that isn't inherited can also happen, similar to a typo that appears while typing a document. What might you actually feel? Delayed puberty. You might still look pre-teenish at an age when peers are growing taller and developing facial hair. Very small testicles in boys or absence of periods. Primary amenorrhea in girls. Low libido and infertility later in life, because the body never got enough testosterone or estrogen. Loss of smell anosmia. You may notice you cannot smell coffee, perfume, or even a rotten egg that others detect. Bone health issues. Low hormones can make bones weaker, similar to how a house with missing beams can become shaky. Doctors look for 3 clues. Blood tests that show low levels of LH, FSH, and the sex hormones testosterone or estradiol, while the pituitary gland looks normal. Smell tests, a simple "can you identify this scent" check. Imaging such as MRI to see if the part of the brain that should release GnRH is present. If the pattern fits, a genetic test can confirm the exact mutation. Treatment is like turning the thermostat back on. Hormone replacement, testosterone patches for boys, estrogen pills for girls to trigger puberty and maintain bone health. For those wanting children, doctors may give gonadotropin injections or a GnRH pump to stimulate sperm or egg production. Think of it as giving the body the missing signal it needs to start working properly. Because the condition is largely genetic, you cannot prevent it in the classic sense, however. You can reduce the impact by early screening. If a family member has Kallmann syndrome, a quick hormone panel can catch low levels before puberty starts. Genetic counseling for couples who know they carry a mutation, helping them understand the chances of passing it on. Avoiding exposures that could further harm hormone production, for example, certain pesticides or heavy metals. Think of it as keeping the house tidy so the thermostat does not get blocked. Research is moving fast. Recent advances include gene editing studies see CRISPR in mouse models that show it's possible to fix the faulty ANOS1 gene and restore GnRH signaling. Stem cell therapy trials, where olfactory precursor cells are transplanted to re-establish the smell pathway and possibly the GnRH neurons. New long-acting hormone formulations that require only quarterly injections instead of daily pills, making treatment less cumbersome. Large-scale genotype-phenotype databases that help doctors predict which patients will respond best to specific therapies. While these are still mostly in research labs, they give hope that future patients may need fewer injections and could even have a cure at the genetic level.